Hey there everyone. In the previous video we had studied the introduction to the medial side of the thigh, in which we covered the contents, the boundaries and the peculiarities of the muscles and the important nerves and important arteries. So in today's video we are going to study the muscles of the medial side of the thigh, or the muscles of the adductor compartment of the thigh. Okay, so first we are going to see the surface landmarks, which is very important to know from where the bone is from where the muscle is originating and where is it getting inserted, and then we are going to see the origin, insertion and nerve supply, and then the actions, and okay, the common nerve supplies, the hybrid muscles or composite muscles. All of this we are going to discuss in this video. So first let us see the surface landmarks on the bone. So the bones, that is the hip bone and the femur. So first we'll see this. See, these are the origins and these are the insertions. Okay, so this is the ischium part, pubic part and ischium part of the hip bone. Okay, so this is the pectineus muscle attachment. Okay, wait. This is the pectineus muscle attachment on this side, the adductor longus, brevis, gracilis, and the adductor brevis muscle. And insertion, these adductors insert on the back of the femur. Okay, on the posterior surface of the femur bone. They get inserted. Okay, see here, pectineus and the adductor brevis and the adductor longus, mostly on the posterior medial. Okay, this is the posterior. Okay, posterior medial surface, and that too in the upper 1/3, and that too near the linea aspera. Okay, near the linea aspera. Before that, let us see the surface landmarks for a better understanding of the origins and the insertions, okay, of the muscles. See, this is the part of the ischium. Okay, this is parts of the ischium. So this whole is the ischium, part of the hip, like the pelvic bone. And see, this is the medial view. Okay, so this, whatever you see here in the purple color, this is the body of ischium. Okay, seen from the medial side. Just behind that, or from seen when seen from the lateral side, also is the same. That is the body of the ischium. And below that, whatever you see, this is the curved part looking like a crest. It is called as the ramus of the ischium. So what is ramus? Ramus is a prominent part of a bone, that is called as a ramus. Okay, it is connecting to this part. So this is a ramus. Okay, ramus of ischium, and above that is the body of ischium. This is seen from the medial side. Okay, origins of muscles takes place from this parts. Now from the lateral side, we have already seen from the medial side the body of ischium and the ramus. Okay, so yeah, from the lateral side we see that this is the greater sciatic notch, this is the lesser sciatic notch, this is the ischial spine, and this is the ischial tuberosity here. This is the ischial tuberosity, and we saw that this is the ramus of the ischium, and this is the body of the ischium. Okay, so yeah, this is about the ischium. Now parts of pubis. See, parts of pubis from the medial view, we have the superior pubic ramus and the inferior pubic ramus. As I already told, ramus means a prominent portion of a joint, prominent portion of a bone. So this is the superior ramus, and this is the inferior ramus, and this is the body of the pubis. This whole is the body of the pubis. Okay, this is the body of the pubis. And from viewing it from the lateral view, we have this called as the, this is not required, this is very important, especially the pecten pubis, where the origin of the pectineus muscle takes place. Okay, the pectineus muscle that we will study further. So this is the pecten pubis. This is called as the pecten pubis. So this is looking like a crest. So this is the pubic crest, and you see that this tubercle, you see here, there is a tubercle. So this is the pubic tubercle, this is the pubic crest, and above that is the pecten pubis, where the origin of the pectineus muscle takes place. Okay, now we are going to weave the femur in the posterior view, because all the adductor muscles, they attach or they insert into the posterior surface of the femur. Okay, So see, this is, we know that this is the head, this is the neck, this is the greater truncator and stuff. Okay, so see this line, whatever is going like this, it is a spiral line. We have studied in femur, in the humerus muscle, humerus bone on the back side, in the posterior view we also had a spiral groove or a radial groove, right? So here we have a spiral line. Okay, we have a spiral line. And this is above, just below the lesser truncator, we have this pectineal line. Okay, we have the pectineal line, and there is a tuberosity in the upper part, that is the gluteal tuberosity, and it continues as the linea aspera. Okay, this line whatever you see is the linea aspera. So the linea aspera has two lips, one on the medial side and one on the lateral side. So medial lip of linea aspera and lateral lip of linea aspera, and this is the shaft of the femur. It is divided into three, that is the upper 1/3, middle 1/3 and lower 1/3. The adductor muscles, they attach on the upper 1/3 only. Okay, so these are the supracondylar lines. See, these are the supracondylar lines, and this is the popliteal surface. Okay, this is the popliteal surface, and these are the condyles. Okay, so this is about the surface landmarks on the femur, where the which was very important to know, where the insertion of the muscles of the adductor compartment takes place. Now let us see the muscles. Okay, let us see the muscles, right? So the muscles of the medial compartment of the thigh, it is divided into two types of muscles are there in the medial compartment, that is the intrinsic muscles and the extrinsic muscles. Okay, the intrinsic muscles and the extrinsic muscles. Intrinsic muscles are 5 and extrinsic muscle is only 1. So the extrinsic we'll see first. It is the obturator externus. Okay, it is in the name itself, it is the obturator externus. Okay, and then we have the in the intrinsic we have 5 muscles. So that is the adductor muscle. This is the adductor compartment, so of course the names will be like this. So this is the adductor longus, adductor brevis and adductor magnus. Okay, adductor magnus, a point to be noted that adductor magnus is a largest muscle in the medial compartment of thigh. Okay, then we have the gracilis muscle and the pectineus muscle. Pectineus muscle we had seen just now, we had seen the pectineal okay, pecten pubis, we had seen pecten pubis, right? So this is where the origin of the pectineus muscle takes place. We'll see that. Okay, so see, we already saw this pecten, this is the pecten pubis. So pectineus and adductor longus, gracilis, brevis, and insertion and origins we'll study, right? So see, here is a diagrammatic view. They have used different colors to show the muscle. So this is the obturator externus. Okay, this is the obturator externus, this is the adductor brevis, this is the adductor longus, and this is the adductor magnus. Whatever you see from here till here, this is the adductor magnus. It is the largest muscle in the medial compartment of thigh, and the pectineus is not seen here because the pectineus muscle, it is behind the adductor brevis and adductor, it is behind these muscles. Okay, so it is not seen here. See, this is the pectineus muscle, the adductor magnus, that is the largest muscle. We have the adductor brevis, we have the adductor longus, and the gracilis. Gracilis, it is a slender is a very rope like muscle that is exactly to the medial or the inner thighs, that is the gracilis muscle. Okay, and let's revise as well. Okay, let's revise. This is the sartorius muscle, this is the this is the quadriceps femoris muscles. So the rectus femoris, vastus medialis, vastus lateralis, tensor fasciae lata. Okay, so these are the muscles that we had seen in the front of the thigh. Make sure to check that out if you haven't seen it yet. So talking about the adductor longus, okay, it is a triangular muscle, floor of femoral triangle. It forms the floor of the femoral triangle. Okay, it forms the floor of the femoral triangle. We had already seen that in the femoral triangle video. It lies in the plane of the pectineus muscle. Okay, it lies in the plane of the pectineus muscle. So see, it is originating from the medial 1/3 of shaft of femoris. Okay, wait. Okay, this is the insertion. Okay, it arises as a flat narrow tendon between pubic crest and the pubic symphysis. Okay, we had seen the pubic crest just now. So this is the pubic crest, and okay, wait, this is the pubic crest and this is the pubic symphysis. It arises between this, and this is the adductor longus muscle that arises between the pubic crest and the pubic symphysis. It is a flat narrow tendon, okay, it arises as a flat narrow tendon. It is getting inserted on the posterior posterior surface of the femur. All the muscles are getting inserted into the posterior surface of the femur, okay. So this, we know this is the gluteal line and this is the linea aspera, and this is the medial the medial lip of the linea aspera as we saw in the diagram. So let's see here. Medial 1/3 of shaft of femur. See, I told you, right, 1/3 of shaft of humerus to the medial side, because it is the muscle of medial compartment, and it is getting inserted into the linea aspera between the vastus medialis, adductor brevis and magnus muscle. So it is not very important to remember these muscles, but if you want to remember, just remember MBM, okay. So that is medialis muscle, the brevis muscle and the magnus muscle it is getting inserted into. So it is getting inserted into the medial 1/3 of the shaft of humerus in the linea aspera, that is the medial lip of the linea aspera, okay. So the nerve supply of all the muscles of the adductor compartment is done by the obturator nerve, okay, either the anterior division or the posterior division, okay, anterior or posterior. Action is, it is a powerful adductor of the thigh, adductor compartment. Of course the action will be adduction, okay. Powerful, it is a powerful adductor because it is long, right? No matter Magnus, adductor magnus is the largest muscle, but adductor longus, it is in the name, right, longus, so it is powerful. So the adductor longus is the powerful adductor of the thigh, and it controls the posture, okay. It is a posture controller. So we are done with the adductor longus. Now let's move to adductor brevis, okay. It lies behind the pectineus and the adductor longus muscle, okay. The brevis muscle, it lies behind the adductor longus and the pectineus muscle, okay. See, so its origin is the body of the pubis. It arises from the body of the pubis, inferior ramus of the pubis and the ramus of ischium, okay, the ramus of ischium. You remember it arises from the pubis part, and you can write these two, and it also arises from the ramus of ischium as we have seen in the surface landmarks, okay. So not very important to remember these muscles, okay. So supported by the gracilis and the obturator externus and the gracilis and the adductor magnus, okay. So the insertion of this muscle is again on the posterior surface of the femur. So it is on the line extending from lesser truncator to upper part of linea aspera on the medial side, okay. On the medial side we saw that this is the greater truncator on that side, on the anterior, and this is the lesser truncator. This is a line arising from the lesser truncator to the upper part of the linea aspera, so on the medial side, okay, it is inserted there. So the nerve supply is again by the obturator nerve, but by the anterior and the posterior divisions. See, for adductor brevis, you have to remember one thing, that adductor brevis is not a hybrid or composite muscle, okay. Hybrid or composite, what do you mean by hybrid or composite? It means if the muscle is having dual nerve innervations, of if the muscle is supplied by two nerves, it is called as a composite or hybrid muscle. Since adductor brevis is not a composite muscle, then why anterior and posterior divisions of the obturator nerve, and it should be anterior or posterior, because if the anterior division is supplying, then the posterior will not, and if the posterior is supplying, then the anterior division of the obturator will not supply the adductor brevis. Either of दोनों में से एक ही डिविजन ऑब्ट्यूरेटर नर्व का adductor brevis को सप्लाई करता है. So what are the actions of this muscle? Of course the adduction and the flexion of thigh, okay. Remember, it helps in the flexion of thigh, okay. Adductor brevis, it helps in the flexion of thigh. Now moving to the adductor magnus. See, it is the largest muscle, okay. It is the largest muscle, and it is a hybrid muscle, okay. Dual nerve supply, as I have already told. So which are the two muscles that have the dual nerve supply? That is the pectineus muscle and the adductor magnus muscle, okay. Adductor magnus muscle, okay. See, the origin, it is originating from it has two heads, okay? It has not two heads, I mean it has two parts. The adductor magnus, that is the largest muscle. It has the adductor part and the hamstrings part, okay? The adductor part on the medial side and hamstring part on the posterior side, okay? Slightly on the posterior side, okay? The adductor part of the adductor magnus arises from the or originates from the outer surface of the ischiopubic ramus. Ischiopubic ramus, as we have already seen, right? This is the ramus and this is the pubic ramus and this is the ischial ramus. So ischiopubic ramus, okay, the adductor part, it arises from there, and the hamstring part from the ischial tuberosity, inferior lateral ischial tuberosity. You have seen there was an ischial tuberosity, it arises from there, okay? Now the insertion of this muscle, we see the insertion. See, the adductor part on the medial margin of the gluteal tuberosity, okay, medial margin of the gluteal tuberosity. We had seen, suppose, so this okay, this is the neck head, this is the neck, the greater truncator and the lesser truncator. In between here in the upper region we had the gluteal tuberosity. So it is they are saying it is a medial margin of the gluteal tuberosity. Medial margin bole to here at this place, medial margin of the gluteal tuberosity and linea aspera. Below this is the linea aspera, okay? And medial supracondylar line, it goes to little downside. So this is the medial supracondylar line, it goes to the medial supracondylar line. And the adductor tubercle, we also have the adductor tubercle on this side, so this region, okay? The adductor head on the medial lip, okay, the medial margin of the gluteal tuberosity and the linea aspera on the medial side, and the hamstring for on it goes below, okay? The hamstring, it goes below to the supracondylar line and the adductor tubercle, okay? So remember, you can remember it easily, but if you forget it, just remember the word lamb, okay? So L for linea aspera, A for the adductor tubercle, and M for margin of the gluteal tuberosity and the medial supracondylar line. So adductor, it is on the upper shaft of the humerus, and the hamstring, it is on the lower shaft of the humerus, okay? See, it's on the supracondylar line and the adductor tubercle, the upper for the gluteal tuberosity and the linea aspera. So for understanding this more better, you should be thorough with the parts of the bone, okay? Which part of ischium is called what? If you remember then it will be very easy. So the nerve supply, it will be by the two, okay? See, it has two heads, right? Adductor not heads, I'm sorry, it has two parts, the adductor part and the hamstring part, and it has two nerve supplies, okay? Two nerve supplies. So adductor part by the posterior division of the obturator nerve, and the hamstring part by the tibial part of the sciatic nerve. Just remember, posterior division के लिए कौन सा nerve supply करता है? That is the sciatic nerve. Now it is getting inserted on the tibia, right? So tibial part of sciatic nerve. Which one? The hamstring part. It is going downward, so down to the tibia. So the tibial part of the sciatic nerve, and for the adductor, the posterior division of the obturator nerve, okay? The nerve supplies of course the adduction and medial rotation, okay? Adduction and medial rotation. See, it helps in the medial rotation of the hip, okay? Medial rotation of the thigh. And the hamstring part helps in the extension. All the hamstring muscles helps in the extension of the thigh, so the hamstring part will also help in the extension. Now seeing the gracilis muscle, it is a slender, okay? It is a slender muscle. Greek, okay, in Greek word gracilis means slender, okay? It is the most superficial muscle. Remember that it is the most superficial muscle, and it has got its clinical importance as well, okay? So this is the gracilis muscle. This is the gracilis muscle. It is originating from the body and inferior ramus of pubis, again body and inferior ramus of pubis, and a part of ischial ramus. See, it is originating from the inferior and the body of the pubis and the part of the part of the ischial ramus, okay, part of the ischial ramus, and it is extending and getting inserted onto the tibula. This is a muscle that is not getting inserted on the femur, okay, it is getting inserted on the tibia. So upper part of medial, upper part, of course it is getting inserted in the upper part on the medial surface of tibia. Medial surface because it is a medial compartment muscle. Upper part, okay, you can already see here, and upper part medial surface of tibia behind the sartorius and the semitendinosus muscle, okay. Yes, square, sartorius and the semitendinosus muscle, not very important to remember, okay. Now the nerve supply is by the anterior division of the obturator nerve, the anterior division of the obturator nerve, okay, anterior division of the obturator nerve, and we know that this is not a hybrid muscle, okay. Now the actions are adduction and flexion, okay, flexion also, adduction also, but also flexion, okay, it helps in flexion. Medial rotation के लिए कौन सा muscles help, that is the adductor magnus and the gracilis muscle, okay, medial rotation, and it is a weak adductor, it is an adductor, but it is weak adductor. Powerful adductor कौन है? That is the adductor longus, it is long, tall, so it is powerful adductor, okay. So we are done with the gracilis muscle. Now we are going to see the last muscle, that is the pectineus muscle, okay. See, this is the pectineus muscle, it is from the upper part, right. So the pecten pubis, as I have already shown you, the pecten pubis in the surface landmarks, arises from the pecten pubis and pectineal surface of pubis, okay, the pectineal surface of pubis, and it is getting inserted into the line, that is the lesser truncator line to the linea aspera. See, we'll see here. So this is the greater truncator on the front side, this is the lesser truncator, the line extending from the lesser truncator to the the linea aspera, okay. So this is the gluteal tuberosity on the upside, this is the gluteal tuberosity, and this is the linea aspera, from the line extending from lesser truncator to the linea aspera. Now the nerve supply is it has two fibers, okay, the anterior fibers by the femoral nerve and the posterior fibers by the obturator nerve, okay. The anterior also, okay, the anterior also called as the medial, okay, and the posterior also called as the lateral. No, this is for the another chapter, okay, I'm sorry, don't keep that in mind, okay. The anterior fibers for the femoral nerve, we know that the anterior compartment or the front of the thigh supplied by the femoral nerve, so remember the anterior fibers by the femoral nerve and the posterior fibers by the obturator nerve, okay. Posterior meaning the medial, okay, posterior meaning the medial, anterior meaning the lateral, okay, just remember this. And see, its action are of course adduction and flexion of thigh, okay, flexion of thigh. So this is about the pectineus muscle. We saw that it has dual nerve supply, and the adductor magnus muscle as well, it has dual nerve supply. See, it is a dual nerve supply, so adductor magnus and pectineus are the hybrid muscles in the medial compartment of thigh, okay. See, all muscles are supplied by the obturator nerve, of course all muscles are supplied by the obturator nerve, and pectineus muscle and the adductor magnus muscle are supplied by two nerves, okay, supplied by two nerves, obturator and obturator, of course, and pectineus by the femoral nerve, okay, pectineus by the femoral nerve, and the adductor magnus by the tibial part of the sciatic nerve. Why by the tibial part of the sciatic nerve? Because it is getting inserted onto the lower part of the femur, so it is supplied by the tibial part of the sciatic nerve. This is how you remember. And the pectineus by the femoral nerve. Okay, so this is about the muscles, the nerve supply, attachments, insertions and origins. Hope you understood. Thank you so much.